Cancer is a continuously growing global health problem that poses major challenges, most especially in developing countries. Find out how this international distributor of innovative health products came up with a series of solutions to help increase a patient's chance to survive the odds. In 2020, the Philippines hit a record of 354,398 prevalent cancer cases within a 5-year period. But because of poor access to health care, especially for people living below the poverty line, the advances and breakthroughs in cancer remain unattainable to many.
Cancer refers to a group of diseases that's characterized actually by cell growth, abnormal cell growth and proliferation, inflammation, as well as angiogenesis or formation of new blood vessels. It always starts with mutation in the genome or the genetic makeup of a person inside the cell. Before PPARs, most of my patients, they were unable to finish the chemotherapy regimens because of the side effects and because of discomfort during the process of chemotherapy.
Maria's son Dominic was diagnosed with stage 4 rhabdomyosarcoma when he was only 4 years old. While coping with the recovery of her other sick child, Maria found it hard to accept Dominic's condition.
It was actually very devastating kasi with Dominic, it was manifested mga 4 years old na siya eh. Unlike dun sa daughter ko na congenital talaga, baby pa lang. Yung mga bandang September, meron nang umuumbok-umbok dito sa leeg niya. Hindi ko talagang inisip na cancer kaagad siya until nag-nosebleed siya.
Dominic was prescribed chemotherapy, but his family insisted to rush to an integrative doctor to seek for alternative cure.
Medyo hesitant ako kasi as a mother, I know the side effects ng chemotherapy kasi. So what I did is that I rushed towards the integrative doctor of my daughter, who happened to be PPAR partner doctor of Simply Nature.
One of the hardest decisions to make for people living with cancer is choosing the kind of treatment that would work best. To help patients and their families deal with this growing health problem, one company commits to producing safe, credible, and natural health solutions by drawing on the latest bioscience technology to deliver a series of safe, efficient, and natural products. What is Simply Nature and what does it do?
Simply Nature is a company we created and founded about 10 years ago. Our mission is to find effective health solutions for people. So we provide natural products that work in combination with conventional therapy and medicine.
As an international company that provides natural solutions for cancer, metabolic syndrome, and degenerative diseases, the management upholds a health philosophy that centers on whole food nutrition as the frontier in health management.
When we talk about choosing treatment, especially in the area of cancer, patients are really afraid of chemotherapy because of its side effects, and they tend to then look towards natural products. But this is not a either conventional or natural choice. At Simply Nature, patients can have the best of both worlds. Our protocols work with conventional chemotherapy to minimize its side effects so that they can get the best treatment using both conventional and natural together.
Cancer is like a virus. It continuously evolves, it mutates. So it can develop defenses against our usual treatment modalities like chemotherapy.
Like I said, chemotherapy and radiation therapy have a lot of side effects. So more often than not, patients stop their treatment because of these side effects. It's very important to have the support.
With the supplements that we give the patients, there will be lesser side effects, so they will be able to finish their chemotherapy protocols more comfortably.
This company introduced PPARs, which is touted as one of the best natural ways of solving serious health problems.
PPARs stands for peroxisome proliferator activating receptors. It's basically a nuclear receptor inside the cell, activated. The benefit that you can get from that is, number one, cellular differentiation. Number two, it's to promote fatty acid metabolism. If you have better insulin function, your blood sugar will naturally go down. And another one is to induce cancer cell death by modulating the immune system.
As a sole distributor of PPARs, the company promotes its use to many reputable health institutions worldwide and actively organizes corporate health conferences and public health talks in Asia.
Simply Nature PPARs is made out of a special strain of these types of microalgae that is very effective by protecting the bone marrow. We maintain the integrity of the immune system of the patient, which is very important to prevent infections and to fight off the cancer itself. And also, Simply Nature PPARs is also very dense in nutrients so that the patient can recover faster because of better cellular healing.
Sabi ko parang na-lead kami to an extraordinary and I must say amazing journey. I'm very proud of him. At a young age, na 8 years old, he believed that it's his purpose to siguro encourage other people then. We would like to really pay it forward with the knowledge that there's really like Simply Nature that can help people with cancer very much.
When fighting cancer, living healthy is very important because it allows us to pursue what is important to us in life, and that's what it's all about. When we can help a patient move from being bedridden to getting up, to be lucid in thought so that they can have conversations with their loved ones, it gives the whole process of fighting cancer a whole new meaning. And that is what drives us at Simply Nature.
CA markers.
Mataas siya. Then, nung after 3 months, nung pag-take ko ng Simply Nature, doon, naging normal na siya until now. Kahit si Dr. Johan na gulat siya kasi biglang normal agad in just 3 months, nag-normal agad yung CEA ko. 1 year and 5 months, cancer-free. Dapat may food supplements kayo, like Simply Nature, na proven and tested ko na. Talagang hindi ako pwedeng mawala ng Simply Nature na yun.
2019, I was being diagnosed a cancer of my uterus. So I was shocked. Sabi ko, bakit nagkaroon ako ng ganito? Samantalang hindi ako mahilig sa pagkain. I'm sorry, basura. Started the tablet and then the powder. Tinry ko din yung yung tawag dito.
Gel?
Yeah, yung gel. Yes. It's really good. After 2 months ng aking therapy and taking PPARs, sabi ni doktora, magpa-laboratory ka na. So, nung nagpa-laboratory na ako, praise God, 2 weeks ago or 3 weeks ago, lahat normal. To God be the glory. Salamat sa Diyos. Sa 2 months ko po ng aking pag-take ng PPARs, ako po ay cancer-free.
ko yung tumor
CA
test,
markers.
mataas siya. Then, nung after 3 months, nung pag-take ko ng Simply Nature, doon, naging normal na siya until now. Kahit si Dr. Johan na gulat siya kasi biglang normal agad in just 3 months, nag-normal agad yung CEA ko. 1 year and 5 months, cancer-free. Dapat may food supplements kayo, like Simply Nature, na proven and tested ko na. Talagang hindi ako pwedeng mawala ng Simply Nature na yan.
2019, I was being diagnosed a cancer of my uterus. So I was shocked. Sabi ko, bakit nagkaroon ako ng ganito? Samantalang hindi ako mahilig sa pagkain. I'm sorry, basura. Started the tablet and then the powder.
The powder.
Tinry ko din yung yung tawag dito.
Gel?
Yeah,
Oh,
yung gel.
gel?
Yes.
Yeah.
It's really good. After 2 months ng aking therapy and taking PPARs, sabi ni doktora, magpa-laboratory ka na. So, nung nagpa-laboratory na ako, praise God, 2 weeks ago or 3 weeks ago, lahat normal. To God be the glory. Salamat sa Diyos. Sa 2 months ko po ng aking pag-take ng PPARs, ako po ay cancer-free.
CA markers.
Mataas siya. Then, nung after 3 months, nung pag-take ko ng Simply Nature, doon, naging normal na siya until now. Kahit si Dr. Johan na gulat siya kasi biglang normal agad in just 3 months, nag-normal agad yung CEA ko. 1 year and 5 months, cancer-free. Dapat may food supplements kayo, like Simply Nature, na proven and tested ko na. Talagang hindi ako pwedeng mawala ng Simply Nature na yan.
2019, I was being diagnosed a cancer of my uterus. So I was shocked. Sabi ko, bakit nagkaroon ako ng ganito? Samantalang hindi ako mahilig sa pagkain. I'm sorry, basura. Started the tablet and then the powder.
The powder.
Tinry ko din yung yung tawag dito.
Gel?
Yeah,
Oh,
yung gel.
gel?
Yes.
Yeah.
It's really good. After 2 months ng aking therapy and taking PPARs, sabi ni doktora, magpa-laboratory ka na. So, nung nagpa-laboratory na ako, praise God, 2 weeks ago or 3 weeks ago, lahat normal. To God be the glory. Salamat sa Diyos. Sa 2 months ko po ng aking pag-take ng PPARs, ako po ay cancer-free.
For women who were diagnosed with ovarian cancer very early on in life and who still want to have kids, there's an option for them, which is called tumor debulking. So for tumor debulking is just getting a portion of the ovary which has the tumor. So you remove that, and then the doctors will close you up. Then you can now still give birth, conceive. Now, if there's still if the tumor is still not that huge, no, then you can conceive first. Once you give birth, then that is the time they remove everything.
Hi everyone, welcome to another episode of Simply Healed, our regular Thursday series on cancer. And we have today with our resident doctor, Dr. Jansen.
Hello Sean, hello everyone, glad to be here again. So tonight we're going to be discussing all about ovarian cancer. Okay, so for all of our female viewers out there, no, and of course for the husbands.
Yes, the husbands.
The husbands as well. So you should know these things as well. Okay, so without further ado, let's begin, no? Okay, because the topic is quite long, so let's start. So first, let's locate where is the ovary. Okay, so the ovary is located here, as you see here in this image. So it's located in the lower part of the abdomen, at the left and right side. Okay, so this is the picture of the actual picture, the gross anatomy of the ovaries. Okay, so as you can see there, the two white oval shaped organs there, those are your ovaries. So in the middle, that is the uterus. And going down, that will be a part of your cervix already, part of the vagina. Okay? So the next picture is ovarian cancer.
Wow.
That has a spread. Okay? So
Wow.
You can see here, no? It looks like a cauliflower. Okay? So this is what ovarian cancer looks like. Okay? So next, let's discuss what are the symptoms of ovarian cancer. So these are the symptoms. And as you can see, the symptoms are really very non-specific. If you feel these symptoms,
It could be anything else.
It could be anything else. So that is why it can be quite dangerous.
Because you won't know.
Because you won't know that
You won't
it's already
suspect.
serious. You won't suspect that it's already serious. I mean, abdominal bloating and there's swelling. I mean, you can just
It could just be indigestion.
Indigestion. You ate sweet potato or kamote, right? Then you feel the bloatedness. So that's one. Or quickly getting full when eating. You easily get full. Some people just
easily get full.
Yeah. Okay. So another one is weight loss. Okay. You
That
can
might
just
be, people
weight
might
loss
even
can-
be thinking it's a good thing
yeah,
that
it's a
they're
good
losing
thing.
weight.
Yeah, it can be a thyroid problem. It can be, you just ate less. That's why you are stressed out. That's why you lost weight. Okay, discomfort in the pelvic area. I mean, what does this even mean?
And of course, when women have menses, they
Yeah.
have discomfort in the
Exactly.
pelvic area.
Yeah. Okay, so fatigue, back pain, changes in bowel habits, frequent need to urinate. So all of these symptoms are really very non-specific.
So, Doc, how do you catch? I mean, this is a question not only for ovarian cancer, right?
Diagnosing ovarian cancer early on is really very difficult because more often than not, early stage ovarian cancer, the ones that we catch very early on, are incidental findings. Okay, so
You went in for something else.
You went in for something else. I mean, discomfort in your pelvic area. I mean, you frequently urinate a lot. That's why, if you urinate a lot, that's what UTI. I mean, and it's recurring. So the doctor will now think of another else. So the doctor will now issue or order an ultrasound, and that's when you diagnose these kinds of things. Okay, and another one is the risk factors. Okay, you need to have these risk factors in order for the doctor to suspect that you have these risk factors. Then most likely what you have or what you are feeling right now is because of ovarian cancer. So what are the risk factors? Older age, okay, so senior citizens. Genes, BRCA1 and BRCA2. So if you have a family history of breast cancer, okay, so BRCA1 and BRCA2 are genes that gets turned off. So that's why you develop breast cancer. Okay, family history of ovarian cancer. So this is when you suspect so you suspect highly that what you have is ovarian cancer, right? So another one is overweight and obesity. Okay, so
Doc, I'm looking at your list right now. I saw one that is very interesting. If you have never been pregnant, and I assume that means you are now not so young because you passed that stage. And I think this is something that's happening more and more, especially in developed countries. More and more women go through life, even though they are married, never getting pregnant.
Yeah.
So this is something which I think for our viewers is something worth taking note of if your loved ones or yourself is in this category. So just take note that not having been pregnant actually raises your risk of ovarian cancer. So the next time you go for a full medical checkup, be mindful of that.
Yeah, okay? But here's what I want you to notice with the risk factors. There's a commonality here that is related to your lifestyle. Okay? So take a look at overweight and obesity,
High
cholesterol intake. Okay? Dietary cholesterol can only be found in animal food products. Remember that.
Wow.
Or if
I
you,
forgot that. So thank you, Doc, for reminding.
Yeah. Or if you are just eating very high fat meals, no? High fat food intake, use oil a lot. Okay? Another one is postmenopausal hormone replacement therapy. Postmenopausal hormone replacement therapy is estrogen pills. Okay?
That causes?
Yeah, it can increase your risk for ovarian cancer. Another one is early menarche or late menopause. So what is menarche? Menarche is the start of your menstruation at an early age. So how early is this? 9 years old, 10 years old, that's early menarche already. Okay?
So that will result in you developing ovarian cancer later in life?
Risk, yeah, a higher chance.
Later in life?
Yeah, later in life, a higher chance. Okay, so these are probabilities. Okay? And take a look at late menopause. Late menopause is when you still have your mens up until 55 years old, okay? Alright, so that's already late menopause, 55, 57, late menopause, okay? So early menarche, late menopause. So throughout your life, you are exposed to estrogen, okay? If you're overweight and obese, you have high estrogen.
Oh.
If you're taking postmenopausal hormone replacement therapy, those are estrogen pills. Estrogen again. Never having been pregnant. Okay, so pregnancy actually we have two female hormones.
Yes.
Estrogen and progesterone.
Yes.
During pregnancy, it's the progesterone that goes up. Estrogen actually becomes more stable at this point in time. So if you haven't been pregnant, so the cycles of estrogen, the peaks and troughs of estrogen will happen more in your body because you haven't been pregnant, okay? So, more exposure to estrogen increases your chance of getting ovarian cancer if you take a look at these factors. Now, having said that, this translates to the lifestyle as well because early menarche, late menopause, you can't really control that, okay? Never having been pregnant, I mean, it's by choice. I think it's by choice. And then postmenopausal hormone replacement therapy. So that is something that the doctor gives you already if you have really very bad
side
effects of like hot flashes, postmenopausal symptoms. No, so these factors are really not within your control. But what is within your control? It's the food that you eat. Okay, especially what dairy products. Dairy products have estrogen in them. So you have to be very careful. For those of you who loves drinking milk tea, loves eating cheese, yeah, those things can also increase your risk of getting ovarian cancer later in life because of these similarities in the risk factors.
So these dairy products, these estrogens are because of our farming techniques, or is it just inherent to milk itself?
Inherent to the milk itself. Because cows, I mean, when they get pregnant, they produce milk. Yeah. So when they get pregnant, estrogen, their hormones inside their body will surge up high. And dairy or cow's milk is made to allow a small calf
to grow very big.
To grow very big
in like
in a very short period of time. Okay, so that's why. So you have to be very careful with these food.
So it's very interesting for ladies. If you are part of this risk factor, there's a very compelling reason for you to really watch your intake of dairy products.
Yeah. So now let's go to statistics. So ovarian cancer is the 7th most common cancer in women, 5th in cancer deaths among women, and the lifetime risk is actually 2.7% in the absence of protective factors. So the chances of you getting ovarian cancer is really quite small. Okay. Yeah, but when you do have this, no, usually it's really bad. Okay, so what are the protective factors? Okay, so what can you do to protect yourself or to reduce your risk for getting ovarian cancer? Number one is full-term pregnancy and breastfeeding. So if you gave birth, no, full term, and then you breastfed your kid, 22% reduced risk. Birth control pills as well. So 7% reduced risk for each year of use. But for birth control pills, these pills increases your risk for breast cancer. So it's a balance of both worlds. Okay. So next is tubal ligation. So you ligate the fallopian tubes, no? So take a look at the normal, at the anatomy of the ovaries again. So you see the uterus, right? It's the round thing in the middle, dome-shaped thing in the middle, and then the one that connects the dome shape to the white oval organs or the ovaries, that small ligament there, it's the tubes, okay? The fallopian tubes. You remove that, okay? That is tubal ligation, or you resect the fallopian tubes. Another one is hysterectomy. You remove the uterus, everything, and the plant-based diet. With just a plant-based diet, you have 23% reduced risk of getting ovarian cancer.
Well, that is the single highest, most protective thing you can do. All right, so this is a good reason. Okay, for ladies, and you know, it will also help in body management, weight, and all of that as well.
Okay, so how do we diagnose ovarian cancer? Number one is physical exam, so a pelvic exam. So your doctor, when you come see your OBs, the number one thing that they will do is to do a pelvic exam. Okay, so they will palpate for tenderness over your abdomen, and then do an internal examination, see if there are palpable masses inside. Okay, so another one is ultrasound with Doppler studies. Okay, as you can see here in the images. So this is what an ultrasound looks like. Okay, this is what an ovarian mass looks like in ultrasound. Okay, so it's a round shape, irregularly shaped mass tumor that is dark. Most of the time it's dark. Sometimes it can be mixed. No, there are certain gray areas inside the tumor. Okay, but one of the characters that makes us suspect that what you have or the ovarian mass is malignant is that if it has a mixed colors of gray and dark areas. Okay, and it lights up in ultrasound. Okay, that's why we need Doppler studies, because the Doppler, the Doppler effect, no, the sound effect, that produces color depending on where the blood flow is going. Okay, so if it lights up in ultrasound in the Doppler study, then it has inside the tumor has blood vessels. Okay, so that makes it
very likely cancer.
Okay? Then CA125. CA125 is a tumor marker for ovarian cancer, but remember, CA125 is also non-specific. It can increase in a number in different cancers as well. Okay, so you should not rely on CA125 alone. Okay, CA125 should be interpreted always with other diagnostic tests. And of course, lastly is biopsy. Biopsy is the diagnostic confirmatory test to do for ovarian cancer. Okay, so after you get diagnosed, after you do the imaging, next is the staging. Now, I have shown here a very crude way to stage ovarian cancer. No? So this is not the actual staging.
But this is something we can all understand.
Yeah, this is something that,
easy to understand.
Okay, so stage 1 is the tumor is limited to the ovaries, one or both. Okay, if it's stage 2, the tumor now will involve the uterus and the other pelvic tissues. Okay, and stage 3 now involves lymph nodes.
So it has spread.
Yeah, it has already spread regionally. It can spread to the liver, to the spleen, and the peritoneum, or the walls that surrounds your abdomen. Okay, and then stage 4 is stage 4 is metastasis to the distant lymph nodes or the organs found outside the abdomen. So usually it's the lungs that gets affected for ovarian cancer. Okay, so that is how you stage. So next is the treatment. So how do we treat ovarian cancer? Number 1 treatment, remove everything. Okay, surgery. So the surgery that patients undergo usually for ovarian cancer is total abdominal hysterectomy with bilateral salpingo or oophorectomy. It's a mouthful. Okay, so what it means is that the doctor will remove your uterus, will remove both ovaries, will remove the fallopian tubes. And then sometimes the doctors will also remove the surrounding lymph nodes to check for regional metastasis.
I mean, I just want to interject here. It seems like removing like a huge
it's a huge part
of the female anatomy. But my Nina is, I think, 82 years old this year. She had a complete hysterectomy when she was in her late 20s. So I mean, just go to show that you can still have a full life, even if you do this.
Yeah. Okay. So now, of course, this type of surgery will apply to those women who do not wish to have kids anymore. Okay, but of course, for women who were diagnosed with ovarian cancer very early on in life and who still want to have kids, there's an option for them, which is called tumor debulking. So for tumor debulking is just getting a portion of the ovary which has the tumor. So you remove that, and then the doctors will close you up. Then you can now still give birth, conceive. Now, if there's still if the tumor is still not that huge, then you can conceive first. Once you give birth, then that is the time they remove everything. Okay, so it can go one or both, one way or either. Okay. Now, for those women who got their uterus or ovaries removed already at the premenopausal stage, what are the concerns or what are the effects that we should be concerned about? So this is what we call surgical menopause. Okay, so before you even went for menopause, you already got your ovaries removed. So now, since the ovaries, it's the one that produces the estrogen. Okay, so you undergo menopause very early on in life. So what are the long-term side effects of this? You increase your risk of osteoporosis. Yeah. Okay. Increase risk of osteoporosis. And then that's about it. But of course, for osteoporosis, we can still do a lot of things to prevent this from happening, even if you got your ovaries removed early on in life.
This is a tip for the AMA session later. Please ask about what is the proper way to strengthen your bones and treat osteoporosis. Because as you heard from Dr. Jansen, drinking milk and dairy products will cause you to have a higher risk of ovarian cancer. And yet, osteoporosis is a common concern among women, and we often think that to drink milk is how we prevent osteoporosis.
It's not. Okay.
I'll keep you in suspense. Ask this during the AMA. How do you get strong bones without drinking cow's milk?
Okay, so next, let's go to the treatment modalities, other treatment modalities. So we have a number like chemotherapy, targeted drug therapy, hormone therapy, and radiation therapy as well. But the more common ones that are being used for ovarian cancer is chemotherapy. So what are the chemotherapy drugs that they use? Cisplatin, carboplatin. So these are platinum-based, paclitaxel, docetaxel. Okay, so these are taxanes. Okay, so targeted drug therapy like bevacizumab, which is an angiogenesis inhibitor. Okay, so familiar with these drug types, no? Then hormone therapy as well, like your tamoxifen and anastrozole. So these two drugs are more often used for breast cancer, but they can also be used for ovarian cancer. Okay, then radiation therapy as well. Okay, but radiation therapy is not that widely used for ovarian cancer, but it can still be an option. Alright, so next is survival rates. Okay, so as you can see here, for stage 1, you have a very high survival rate. Okay, so please take note, so these numbers that you see here, it's a 5-year survival rate. Okay, and these are the survival rates when the patients were first diagnosed with ovarian cancer. So as they go into treatment, these numbers can change. Okay, whether they drop out or they complete their treatment, these numbers can change. Okay, so if you take a look at the number, as you go up the stages, your survival rate decreases and decreases. For stage 4, it's only 11%, almost always a death sentence already. But the overall survival rate is 46%. So it's like a flip of a coin, actually. Okay, so for the overall survival. But as you can see here, if you get diagnosed very early on for stage 1, it's at least 79% of survival. Okay? So, yeah.
So, Doc, we've done so many cancer programs specific on different types of cancer, and the thing that is always here, like this chart that we see, is really how early can you catch your cancer?
Yeah.
So, it seems like we have to do a special episode on how to diagnose cancer and what we can do to try and catch cancer as early as possible. So stay tuned for that one. I think that we'll do that sometime before the end of this year.
Before the end of the year. So stay tuned for that.
I think that one will be so helpful for everybody because and that will be helpful for people who don't have cancer.
Yeah.
Because we've been doing programs that help people who have cancer. So when we announce that program, please invite your friends and family because that's really for them. It's for people who don't have cancer.
Yeah, because cancer is best prevented than cured. Because treating cancer, as all of you know, it's really very difficult. It can be quite morbid sometimes. Then your stress level will be so high. Okay, so it's better to prevent cancer. That is how you win the fight against cancer. Okay.
So look out for that episode. We'll announce it, and when it comes out to all our regular viewers, please share. And you don't have to only share with cancer patients for that episode. Share with all your regular loved ones, friends, and family, because that one will be very, very helpful for those who don't have cancer or just suspecting that they have cancer and want to know how to diagnose, what they can do to catch it early, and also how to prevent.
Yeah.
So without further ado, let's go to our Ask Me Anything segment, where Dr. Jansen and I will be more than happy to answer your questions. All right.
Okay.
Can we just start?
Hi everybody, good evening. Thank you so much, first of all, for joining another episode of Simply Health webinar brought to you by Simply Nature. We are now in the Ask Me Anything portion, which I am sure a lot of you is very excited to be in. Without further ado, I'd like to call on our CEO of Simply Nature, Mr. Sean Lim, and of course, our lifestyle medicine doctor, Dr. Jansen Calalan, to answer all our questions tonight. Good evening, Dr. Jansen, and good evening, Sir Sean.
Good evening, Sheila. Good evening, everyone. Thank you for joining us. We had a great program last week, and we also have a great program this week. Hi, Doc.
Hello, Sean. Hello, everyone. Hello, Sheila. Happy to be here again.
We got to know our viewers, and almost like friends. So today, I'm so sorry to when I read the comments, my heart goes out to our regular viewer, Lily, because Lily just wrote in the chat that she has confirmed metastasis, is it? Yeah. So, we'll be addressing that. And Lily, has Lily ever consulted with you, Doc?
Not that I remember.
Lily, you always watch our program. Why don't you go for a consult with Doc Jansen? The consult's on us. Don't worry about it. All right. So the consult's free. Just go for a consult with Doc Jansen, and let's see what we can do to help you as much as possible. Once again, thank you everyone for being with us. So without further ado, Sheila, why don't we go into the questions Q&A?
All right. Okay. First off, coming from Ms. Line Domingo, question is how to use PPARs for ovarian cancer stage 3B patient?
Okay, for ovarian cancer at stage 3, you should be undergoing chemo. So PPARs should be taken together with your chemotherapy. But of course, since PPARs is it's categorized as a food supplement anyway, and it doesn't have any toxic effects, you can already start taking PPARs before you go into chemotherapy. That would also give you a better chance of fighting the side effects, okay, and to prime your body in preparation for the chemotherapy. Okay, so that's how I would approach your case.
Again, everybody, we always share on our program, and yesterday, Dr. Jansen and I had the privilege to be speakers at a doctor's conference. And it was very well received, so we would like to thank all the doctors of Prima Thank you for your kind words, and thank you for what's that called? And thank you for your support for what we spoke about. And yesterday, Doc Jansen, the message that really came across between the two of us was that there is no one cure-all for cancer. So even though I'm the PPARS expert, and it's sort of my advocacy, but I do it with a great awareness that PPARS is an important key in your fight for cancer. But don't forget, there are many other keys that you need to do as well. So keep your mind open as you go, especially those of you who are consulting with Doc Jansen. Sorry, Lily, just to go back to you, I read your comment more carefully this time round. So it's just that you have been tested positive for that genetic strain, all right, okay, and you want to do preventive. Anyway, go for a free consult with Doc Jansen. Is on us, all right? Yeah, he'll give you a Doc, I just spoke to my neighbor, the one that I referred to you. She's going for the same genetic test.
Oh, okay.
Yeah, she's waiting. So she's also gonna ask you the same question Lily's gonna ask you. So that's really good. All right. Yeah. Next question, Sheila. Sheila, we can't hear you. Sheila, we can't hear you. Or was it?
Sorry, there you go.
Oh,
Can
there
hear
you
me
go.
now?
All right.
Okay, sorry about that. Okay, the next question coming from Miss Lilibeth Ortega. Okay, what are the best foods that will help us to prevent cancer, Doc?
Okay, for cancer prevention, it's easy. Okay, remember these foods. Okay, broccoli, garlic, microalgae like Simply Nature PPARS. It can also prevent. Another one is nutritional yeast, mushrooms. Yeah. What else? Did I forget something? Yeah. I think those are the foods.
Yeah.
I actually listed all the foods I found in the literature that has anti-cancer effects, which can prevent and of course also stop the growth of cancer in my handout to my patients. So if you want to have the handout, just go for a consult. Have a scheduled consult. Okay. So we can also tailor fit the same dietary protocol to your case. Okay.
And last week, Doc, you mentioned one more that is not directly a food that's anti-cancer, but it will help your body create an anti-cancer chemical. That is actually having fiber.
Yes, fiber.
Yeah, I remember something.
You remember that.
Okay, so if you take fiber, the way your body breaks down fiber in the gut, right, will actually create butyrates, which are anti-cancer. It's your own body's anti-cancer chemical, and you create it by eating fiber. So that's another reason, Doc. I mean, this is not the reason, but it's probably another contributing reason why today many people get cancer, because today many people's diet is low in fiber. So our grandparents' time, especially when they were farmers, they ate a lot of high fiber diet, so they didn't have the supplements we have today, but their body created their own anti-cancer butyrates, and that's because they gave the body the raw material, which is fiber. So that's another reason why eating more vegetables and fruits is actually anti-cancer. Not because of the antioxidant, right? Not because of the antioxidant, but simply the fiber itself allows your body to create anti-cancer compounds by itself. All right, so I hope that's a good tip for everybody, and that's another reason why the next time you go out and eat, you would order the salad. Whatever you eat extra salad. All right, yes, and order broccoli, kale, green leafy vegetable. Doc, I just wanted to ask. Our modern day salads is always lettuce. How good is lettuce compared to, example, if you had a choice, lettuce or pek chai? Which one would you say is a better vegetable?
Pet chai.
Pek chai. Okay, there you got it.
Yeah, pet chai. Pet chai is also called bok choy. In other dialects. Bok choy is really quite good. It has very good anti-cancer properties as well. But lettuce, sadly,
especially iceberg lettuce, it seems hollow.
Yes,
I mean, it seems like the most basic of vegetables, not the most nutritionally.
Vegetables are not created equal. God did not
Okay,
create them
vegetables
equal.
are not created equal. So
Yes.
some vegetables are much better than others.
Yes, that's why I specifically emphasize certain fruits and vegetables, certain plant foods. No, in my list, it's not that. They are the ones which was found to have anti-cancer benefits. If God would have created all vegetables equal, I mean all vegetables have anti-cancer properties.
Oh, then eating French fries will be good for your health.
Eating the potato, we wouldn't have the protocol that I would have made would also be different. So it would be like, okay, just eat plant foods and that's it.
Yeah.
And of course, if we take a look at the population around the world, vegetarians, predominantly vegetarian populations would have significantly, I would have had no cancer at all. But of course, it's not true. Even vegetarians can develop cancer.
Doc, I'm so glad you said that, because sometimes for the meat eaters, we'll say, hey, look at that vegan over there, also cancer. I might as well eat my steak and enjoy my life. Yeah, but how come even vegetarians get cancer?
For a variety of reasons. Number one, they eat very high amounts of fat. They eat a lot of processed foods. So
yeah, because a lot of vegetarians are not eating fresh vegetables. They're eating vegetarian dishes like fake meat, gluten, a lot of preserved stuff.
Yes.
Yeah.
So it doesn't necessarily mean that if you are 100% vegetarian, then you can eliminate your cancer risk totally. Okay, it's not realistic.
You must be a good vegetarian.
Yeah,
There's
you have to have adequate, especially B12, no? Because some vegetarians forget to take B12. Okay, and studies have shown as well that if you lack B12, then cancer risks can also increase. Okay, so that's one. Number two, you're just eating a lot of junk food. So vegans totally only eat plant foods.
Yeah, so actually if you
animal food products.
so if you look at a teenager, he's vegetarian because he only drinks Coca-Cola and eats potato chips.
Yeah.
So he's technically vegan, right? But that doesn't lead to good health.
Yes.
So I'm glad that we tackled this topic. If you are thinking of not being vegetarian, not going vegan, not going plant-based because you say, hey, look, my neighbor vegetarian for 20 years also have cancer. So that's a valid accusation, all right? But when we look closer, it's because as a plant-based eater, they ate a lot of processed plant-based foods. So I know there's a lot of fat now with Beyond Meat, Impossible Burger,
Yes.
right? So I always felt that that's something wrong, because if you want to go plant-based, enjoy plant-based foods, don't try and pretend you're still eating meat. And in fact, when I look at the ingredients in the fake meats, oh my God!
Yeah, it's highly processed.
It's like, wow, they put lots of different stuff in there.
Yes, it's an ultra processed food.
Yes.
And if as all of you remember, I always tell my cancer patients, avoid ultra processed foods. Okay? So that is the number one thing that you should be avoiding, regardless if it is plant-based or animal-based. Okay.
So to all our audience now, because today we talked about prevention of ovarian cancer, and Doc, in preparation for another talk that we're doing about recurrence, I was so shocked. Ovarian cancer has
very high chance of recurrence.
85% chance of recurrence. That means even if you have a hysterectomy, which is to remove everything, there's an 85% chance your cancer will come back. So that's tough.
Yes.
That's tough. So let's continue with the questions. Sheila.
All right.
Yeah.
Thank you, sir. Thank you, Doc Jansen. Okay, next question coming from Ms. Lori Lim. But before I read the first question of hers, Ms. Lori Lim, please also mention what kind of vaccine does your sister got injected with? Okay, but the first question that she has is, Doc, is it really necessary to go for surgery right away when diagnosed with bukol or lump or cyst?
Not immediately. It has to be assessed first if you are even a candidate for surgery. Because sometimes tumors can be very difficult to remove because they are encasing vital blood vessel. So if that's the case, then you will not be a candidate for surgery. The doctors would not operate on you, especially if that blood vessel is a major vessel. So for example, for pancreatic cancer, if it encases the aorta, so aorta is the biggest blood vessel in your body. If that is nicked, even nicked, you will die, you will bleed to death inside. Okay, so if the tumor is surrounding that, then it will not be resectable. So you should be undergoing other modalities. Okay, and sometimes the tumor is also too big to be removed. So the surgeon will first shrink it down by using radiation therapy or chemotherapy. But more often than not, it's chemo. Okay, if it's too big, shrink it down first, then remove it. So these assessments has to be done first before the surgeon decides, okay, let's go for surgery.
Doc, one possible angle that the viewer is actually coming from is that they have a tumor or a cyst. I have spoken to some surgeons before, whether it's benign or malignant, cut it out lah.
Yep.
So would you still recommend it? That means if the location is operable, it's not risky, it's not near a major artery, if it's a straightforward operation and it's not cancerous, would you also agree with the surgeons to remove it? Because surgeons will be very happy to do what they're trained to do, right? Yeah.
Yeah, I would.
Oh, okay.
Just to be sure, okay? Because we have something for benign tumors. So if it's malignant, then it would be better to be cut it off immediately, especially if it's really small. So with that, we're set. However, for benign tumors, so doc, it's benign, so it's not really harmful, but it's there. Okay, and it's really not bugging me at all. So
why risk surgery?
Why risk surgery? Okay, because we have something what we call as a malignant transformation. Okay, so a benign tumor on the get-go can become malignant later on. Okay, although it rarely happens, but it happens. What if you are one of the statistic? Okay, so just to have a peace of mind, so that you won't regret it later on, just have it removed right now, since it's just a minor surgery. Okay, I actually encountered a lot of this kind of patient. When I was an intern, a student, we frequently go to medical missions. So I joined one surgical mission. So we saw this one guy. He had a lipoma. So a lipoma is just a fat
build-up
on his back. Okay, so my mentor, my boss back then, tried to palpate it. Then he also invited me to, hey, Jansen, can you feel
check
this? Yeah, check this out. Okay, so I felt it. And so he asked me, okay, what can you tell about the tumor, the mass? Okay, so I told him that. So I began to explain. Okay, describe the tumor. So it's around 2 by 2 centimeters. It's round. It's well. The shape is quite regular. It's round, and it's in between soft and hard. So it's actually quite firm. Okay. However, so my boss back then. Okay, this type of tumors should be removed.
Oh.
Why? Okay, why? Because the physical exam seems benign, okay, and it's a lipoma, okay. It's really slow growing. However, he decided to remove it because it is firm. Okay, it already has characters of
Cancer.
becoming malignant. Okay, even though the shape is quite regular, it's quite round. We can actually even draw a border around it. Okay, so it's like that. Okay, it's really fat, and it's movable because one character for malignancy is also a non-movable tumor. So right then and there, okay, let's just have it removed because this person doesn't have any money. Okay.
So if he ever gets cancer, that's going to be far worse than
It's
a
gonna be
simple
far
surgery.
worse. Yes.
Okay.
Okay.
And another thing, I would like to also take the opportunity to share with the viewer who asked this question. I think at the end of the day, my next few statements might result in you having to consult with Doc Jansen, which is this. A lot of surgeries are actually, the techniques today is not like what we think in the past. They don't take a knife and then cut you open anymore, right? Dr. Jimmy, who's our oncological surgeon, surprised me when he was sharing with me how he would actually operate on a person's chest. The cut is like 3 centimeters. That's like, my cup here. Yeah, it's my cup holder's thickness only, right? Very, very small. So I was imagining someone taking a knife and then saw to cut open my ribs. I was thinking that's why surgery is dangerous, right? Because oh my, and then when we watch the medical dramas at home, they always show the patient lying down. Then the cut is very long and big, and the whole hand of the surgeon can go in. Well, maybe your surgery might be that type of surgery, and if you're not sure, just go with a consult with Doc Jansen to ask, hey, my surgeon wants to do this type of surgery. Is it really dangerous? Because on the other side, I want to say many surgeries today are done with minimal invasion.
Yes, that's a trend now.
Yeah, which means the risk is really, really much, much smaller. So our fear of surgery is because we don't understand what surgeons do today. All right. So, but again, it's possible that your surgery is not the small one. So just in case, that we don't make any mistake, go for a consult with Doc Jansen to check that. Oh yeah, your surgery is actually not very minimally invasive. Just have the tumor removed. It's probably going to be a day operation. You don't even have to stay in the hospital at all. Then actually you're worried for nothing, right? So a little bit of information helps us make very, very good decisions. All right? Yeah. Sheila, I can't hear you again, Sheila.
Oh, there you go. Sorry.
Okay.
Apologies on that. But I just want to echo out what Dr. Jansen said a while ago. There's, in a way, there's really consideration into your next actions to take. So I hope that you got encouraged and you got motivated with the good news that they was able to share. Okay? All right. Another question coming from Miss Jen MJ. All right. Can oral contraceptive pills cause ovarian cancer or any type of female reproductive cancer?
Oral contraceptive pills, actually, the link for ovarian cancer, not really. Not really.
Doc, when you say not really, what
Not
we hear
really.
is maybe small possibility.
Yes.
Okay.
Yes.
You say one thing, but we might be hearing another.
Yeah.
Okay.
Not really. No.
So no, is the answer no or small possibility?
It's a small possibility.
Okay.
Very, very small possibility. But oral contraceptives risk for developing cancer is more on the breast.
For the breast.
It's for the breast.
Okay, so not ovarian, but for
Not
breast.
ovarian. Yeah. For ovarian cancer,
I thought that I
should
read
be-
somewhere that oral contraceptives actually is anti-cancer.
yeah, it's actually protective for
That-
ovarian.
Oh,
But
so-
I mentioned not really because some can develop cancer if the oral contraceptive pills are not of good quality.
Okay, so don't go cheap when you are buying drugs. I think actually don't go cheap when don't say I go for the cheapest supplement or drugs. I think that's dangerous. I think for all the mothers and parents in this show tonight, I don't think for any moment you went to the shop and told the person, can you get me the cheapest milk powder for my children? Usually parents would say they have a budget and they will go the most expensive that they can get. So I think when it comes to health and medication, try not to. But I do understand sometimes it's stressful. Yeah, but it's a good warning, Doc. Yeah.
Thank you, Doc.
So
Thank you,
the
Mr.
answer is no. Okay, the answer is no.
It can in fact be protective.
In fact, it can be protective. All right.
The general
To make sure that it's a no, please don't buy some under the table. Get a good brand, something that's trusted. Yeah.
Thank you, Doc. Thank you, sir.
Okay, Doc. Sorry, since we are on ovarian, sorry, Sheila.
It's okay.
Since you're on ovarian, the viewer asked this question. I'm curious as a guy. I don't know whether this is within your field of expertise or not. But is there anything not good about being on oral contraceptives for a long time? I mean, apart from cancer scare, is there any is there a reason why a lady shouldn't be on oral contraceptives for a long time?
For long, stroke.
Stroke, okay.
Yes,
that kills you faster than cancer.
Yes. Okay. For women who are oral contraceptive pills, if you are a smoker, then you can develop stroke much faster because it thickens your blood. When we talk about smoking, that includes secondhand smoke.
Oh, so if you live in a household where someone else smokes and you
someone else is smoking, if you are someone who is commuting, you are inhaling or you are exposed to smoke, then you can also have that risk. So, being on oral contraceptive pills, living in the city, a very a city with a lot of pollution can become
a health risk.
A health risk.
So I guess choose correctly, get married, then you won't need your oral contraceptive. Yeah. So yeah, keep it for a short time while you're single, and yeah.
Doc, I'm just very curious. Yeah, I'm sure the other married ladies out there are also curious, because we hear a lot of disadvantages having the birth control on the side of the ladies. How about putting that fact on the guys, because they have the vasectomy as well, right?
Yes.
Are there any risks for doing that for the guy side?
Oh, if we tie it up, is it?
If we tie it up, actually no. The surgeon will just cut the vas deferens duct. So it's where the sperm from the testes come out.
Yeah. Then where does the sperm go if it doesn't go out?
It just goes out through the peripheral organs and it dies. Then the body will reabsorb it.
Okay, because it's basically protein.
Yeah, it's basically protein. Okay. So it dies. Then if the sperm cells die, the white blood cells will.
Oh no, this is a very good argument that in a married couple is the guy should, since his has no risk compared to the woman.
Compared to the woman. Well,
okay, I'm sorry to all the gentlemen who are in the program. Oh no. Okay.
Because if you try to compare, right, for women, it would leave a scar if you tie the fallopian tube because there are no access. For men, it's just a small incision and you won't even notice it. So if I'm a guy and I see my wife would have to undergo through the knife, the doctor will have to slice and put a scar on her body.
Dr. Jansen is a very good husband.
That's my personal.
Yeah, okay. I think I'll still let my wife do the operation.
I wouldn't want such a scar on the body of my wife.
Okay, oh no, she may be listening right now.
So I'd rather do it on.
Okay, to the other viewers watching us for the first time, we're not making light of the cancer topic, alright? We just wanted to make sure that laughter is the best medicine as it's a good medicine as well. And we always want to also add some happiness to our program, because there is tremendous hope when you want to fight cancer. Your chances are good, all right? These are not the 1970s and 1960s anymore. So don't be so afraid. Smile a little so that your mind can hear your options well. Okay. Yeah, let's go back to cancer questions.
Okay. Hey, I'm not sure if this is also a cancer one because the question coming from Ms. Des Rojo, what if a woman 37 years old don't have monthly period up to now? What is the problem solving of her doc? One time she has a monthly period, but one day, starting year 2013, she doesn't have any monthly period. at all?
I would think that probably this patient would have polycystic ovarian syndrome. Because polycystic ovarian syndrome can be a result of a hormonal imbalance. Okay, so it's a consideration. So I suggest that she go for a consult. If it is polycystic ovarian syndrome, that can be corrected through lifestyle and medication. So it has to be done together. PPARs actually can also help.
Okay, I was about to say that, Doc, because this is something that actually happened to a personal friend of mine, and this friend is now my one of our directors in Singapore. I mean, it happened to her sister. So, we actually don't know the mechanism because this is like just a personal friend's case. It's not like our standard case where it's cancer and things like that. My friend's sister only has period once a year.
Yeah.
Only once a year. And they've been married for like 10 years. They wanted to have kids. So how do you have kids when you only have period once a year, right? She took PPAR extract powder on a daily basis. I think 2 scoops a day. I don't know how. It's so long ago because now she has 3 kids. All right.
Wow.
Sorry, not 3, 4 kids.
4 kids.
Okay, so that's how long ago where she. So I knew it maybe almost 20 years ago when this happened, right? So back then, 20 years ago, we don't know so much about our PPAR extracts that we do today because we did a lot of research since then. But I just wanted to highlight this case. So you said that PPARs could help. How does PPAR help? Because I'm also curious about my friend. How did she end up with 4 kids? Her period became regular after she took the powder. Yeah, so what could it possibly be?
To be honest,
It's quite hard now. It's 20 years ago,
yes,
and we don't know
20
the
years ago,
details.
and the mechanism of PPARs, it's quite complex. Okay, so here is my take on it.
Okay,
Okay,
good guess.
a good guess
All right.
on how it works because PPARs can activate genes.
Yes.
Right? So for polycystic ovarian syndrome, the main cause that happens why women develop this is number 1, it's lifestyle. Number 2, it's genetic. Okay, so the PPAR agonist might have had activated the genes necessary to reverse the hormonal imbalance.
So maybe some parts of their genes were not switched
Yes.
on.
Some parts of the genes might not have been switched on.
That's why they have 1 period only a year. Not that they have
Yes.
0 period, they
Yes.
do, but it's like very not on. Okay.
Yes.
Okay.
And also in
That's a simple
terms
way of
of
looking at it,
in terms of their metabolism. Okay, because in PCOS we also give metformin because women who have
PCOS for
tend to-
metformin, the
Yes.
diabetic drug.
Diabetic drug because women with PCOS can tend to also have diabetes.
All right.
Okay, so if you have diabetes, then your blood sugar increases. Then there would be a question of, hey, is there any lipotoxicity or lipid toxicity inside your body? That's why your blood sugar becomes elevated, or is your liver functioning properly? So there's a question of metabolism here. Now, PPAR agonist actually fixes the metabolism, especially fatty acid metabolism. Okay, so we still, to be honest, we still have to further describe the processes behind this. But so far, the outcomes that we see is PPARs can actually help improve patients who have PCOS.
Yeah, this one is true.
This
Even
is the outcome that we see.
before the pandemic, during the last Prima, one of the doctors, quite a prominent doctor, he's one of the top endocrinologists in Philippines. He actually stood up during one of the Q&A. Instead of standing up to ask a question, he stood up to make a statement. He was just standing up to say that he used soft gel capsules and it works for all his PCOS patients.
Yeah.
So there you go. All right. Not even extract powder.
Yeah.
He just used soft gel capsule. So maybe the severity of the PCOS is different, but yeah. All right, next question, Sheila.
So much good news tonight.
Yes,
guys.
yes.
Thank you. Thank you, sir. Thank you, Doc. Okay. Another question coming from Ms. Lori Lim. Okay. My sister got diagnosed with tumor, but the oncologist suggested a GnRH agonist to be injected rather than going for operation. What do you think about this, Doc?
what kind of cancer did she develop? She or a he?
She.
She, sister.
GnRH agonist. Oh, I think it's ovarian cancer. Okay. GnRH agonist, it's just to control the hormones, okay, that is secreted from her brain. Okay, so it's to the main purpose of the GnRH agonist is to stop the tumor from growing further.
So could it shrink the tumor?
No.
Oh, so it's to stop
It's to stop it from growing.
growing.
But on my personal take is to still remove the tumor. Yeah. Okay.
Doc, since we are on ovarian cancer and that our last conversation really shocked me when we did the taping, which is ovarian cancer has 85% recurring rate. That means after you have a hysterectomy, you are basically 9 in 10 chance or 8 in 10 chance it will come back.
It will come back.
What can we do? What can patients who have ovarian cancer do to minimize that? And how much can they lower that percentage? Can they lower it down to very low that it won't come back? I mean, what can they do?
The problem here is ovarian cancers, in and of itself, it can recur. Okay, it's the character of the cancer. If you do surgery alone and you do not go for the chemo, okay, just have the surgery, have it removed. Now, if it is removed, you're declared cancer-free at that point in time. There's an 85% chance of it recurring. Okay?
Wow, that's
now,
very high.
In order to reduce that percentage, okay, you have to undergo chemo. Okay?
Why, Doc? Why?
It's to eradicate all the microscopic cancer cells that's still circulating inside your body after the surgery. Okay? So, chemotherapy is really very important. Now, what if the ovarian cancer that you have evades the immune system or evades the evades the immune system? Okay, now you have to consider the use of immunotherapy. However, even with you would now have to consider the use of immunotherapy. Now, question is, can we still further reduce the chances of recurrence? Yes. Okay. If you use PPAR agonists, it can even further lower the chances of recurrence because PPAR agonist enhances the effect of the chemo as well in killing the cancer cells but not the healthy cells. Okay, because PPAR agonist, if you combine it with chemotherapy, the chemotherapy drug would be able to kill more cancer cells, and the PPAR agonist, since you're taking it, the healthy cells would recover faster because of cellular differentiation. Being PPAR agonists, it can increase the amount of antioxidants that your body has to clean off the damage that has been done by the chemo. Okay, so it's very important to use it together. Okay, so it works hand in hand, and of course, in and of itself, the PPAR agonist also has cancer-killing properties. Now, chemotherapy has also been shown to improve the cancer-killing properties of the PPAR agonist, so it actually works hand in hand. It has to be taken together. Okay?
So I think this is just heads up for those who have ovarian cancer that don't be shocked if your oncologist, even after a successful removal of your after a hysterectomy and you came back, your test, you're cancer free, and they suggest chemotherapy. So don't be angry with them and think that they're trying to make money off you. I mean,
it's
it's
the
not that.
character of the ovarian cancer. It really is. The chances of it recurring is quite high. So please, you have to consider chemotherapy and follow the advice of your onco.
Yeah, all you need to do is just Google recurrence of ovarian cancer, and right in front of me, a Google result will show if you actually have stage 3. Your percentage of recurrence, that means after you treat it coming back is actually 70 to 90%. So and most of the time, if cancer was not diagnosed early, it's very likely stage 2, stage 3. So stage 2 is 30% recurrent rate, 1 in 3 times. You have 1 in 3 chance it will come back. So many people are in between 2 and 3, right? And by the time they finish treatment, they may have gone a bit into the third stage side already. So this is really something worth thinking of. And the good news tonight is You don't ever have to be afraid of chemotherapy, because with Dr. Jansen's protocols and support, chemotherapy side effects, we can manage it very well. All right, and we can also prepare your body so that it's strong for chemotherapy. You go through it, and after that you come out of chemotherapy strong. Your immune system is intact. So then something that used to be fearful, which is chemotherapy, is now less fearful. And this is why, you know, the moment we solve a problem like the side effects of chemotherapy, suddenly things that you wouldn't want to do for your treatment of cancer, you would think, hey, maybe I can do that now. If that can reduce the cancer chance coming back, now I'm willing to do it because I know how to reduce the side effect. I can only think of one simple analogy, right? You know, medicine is good for you, but you, as a kid, you say, this medicine is bad for me because it tastes horrible, right? Yeah, but then the moment your mom says, if you take the medicine, I'll give you the sweet, you're like, okay, and then after a while you think, you know, the medicine does make me feel better, but because of the sweet, now I want to feel better. Because of the sweet, I'll take the medicine as well. So I think the moment you realize here in our program, when we share how successful we are in managing the side effects of chemotherapy, this fear of chemotherapy starts to go away, and then we start to see, wow, it does have its uses. Again, not everybody is suitable for chemotherapy. We're not just pushing it. Make sure it's because your onco recommends it. All right. Then once he does, have a consult with Doc Jansen to see how he can support you through that experience positively. Yeah.
Thank you so much for stating this point, because Doc Jansen and Sir Sean, you know, as you know, and tonight we have a lot of new viewers and new registrants. Okay. And I'm very sure that they are surprised.
Yeah, they're surprised. They were probably
pushing.
Yeah, they are. No, you know, to the new viewers, we are very pro-natural. Okay, it's just that personally, the person who changed my view on this is really the host tonight. Sheila walked into my office about 5 years ago. Sheila, or was it 5 years ago?
Last 2018.
2018, 4 years ago.
Almost 4 years ago.
She walked into my office with her son, who is diagnosed third, fourth stage cancer, and he was only 4 years old. And he was so skinny to the bones. So the first thought that came into my mind is, anything that works for this boy, we should try. So suddenly I didn't say, oh, go natural. I said, in my heart, I was just saying, try everything. Try everything, you know. And that was 4 years ago. Dominic now is just one of the early ones. And since the last 4 years, we have so many patients, right? Even through the pandemic, so many patients go through chemotherapy with us and very little side effects. Everything is manageable, and they all do well in their fight for cancer. So that's the encouragement that I want to give you all.
Such a blessing. Very, very thankful and grateful up until now. And you know what, guys, up until now, I am still learning so much from our doctors, from Dr. Jansen, which I am applying still to my son, who is on remission right now.
Yay! So, congratulations. Dominic is, hallelujah. Okay, I see many questions, like Miss Mendoza and everything. Yeah, let's answer them.
Yes. Coming from Ms. Lloyd Sinatra, if a person is diagnosed with ovarian cyst, how much is the possibility of developing into ovarian cancer? Just the cyst cancer.
It can still develop. However, the chance of it developing into cancer is quite low.
Yeah. If it's low, it means if you take some preventive actions like clean up your lifestyle, then that low chance will be really low.
It would further be reduced.
All right.
However, if you have an ovarian cyst, depending on the size, it would be best to have it removed. Okay, because that cyst can grow really large. I have had assisted before when I was a student. Okay, I have had the opportunity to assist my OBGYN mentors in surgery. Okay, we have had a benign ovarian cyst, okay, which grew to around 36 inches.
36 inches?
Yes.
That's my waistline. Sorry,
It's huge.
my waistline is smaller than that. Wow, it's bigger than my waistline.
It's like this. It's so
Wow.
huge. So the patient came in. Everyone thought that
She's
this
pregnant.
patient is pregnant, but no. This patient is not pregnant. This patient has an ovarian cyst. It can grow that huge.
Okay, so I think that's a very good reason
So if you
to
notice,
remove
if
it.
it's an incidental finding, okay, you just wanted to have an ultrasound for whatever reason, and then there was an ovarian cyst that they were able to detect, and if you notice and that it's growing in size, just have it removed. Okay.
Would the operation jeopardize chance of getting pregnant in the future?
No, you still have another ovary.
Okay. All right.
Okay.
So I needed to ask that on behalf of the viewer.
Yes.
Alright.
Actually, it's a valid concern because, of
Yeah.
course, a lot of women would, of course, would want to have the opportunity to
Have kids.
have kids in the future, right? And if they're going to be removing your uterus, your ovaries, then that would be a big concern. It would be a huge concern. Okay, so if it's still just a small cyst, we have something what we call as oophorocystectomy, meaning it's just removing the ovarian cyst. Not the
nothing
whole
else.
ovary,
Nothing else in your
Okay?
ovary is
And-
removed.
But
Alright.
sometimes, if the tumor is quite huge already, then it would be necessary to remove the whole ovary. However, God gave you 2 ovaries, so you still have 1. Okay? Yeah.
Okay. Or quickly make a baby and then
Quickly make a baby,
and then do the removal of
Do
the cyst.
removal.
Alright.
Okay, while you are
Wow, yeah,
after
yeah.
giving birth, then you can proceed to do the removal. Okay?
Okay.
Thank you, Doc. Thank you, sir. Another question coming from Ms. Mervs Mendoza.
Okay, I
May
see
I
it.
know? All right. May I know what will happen to my right ovary being left after total hysterectomy, abdominal unilateral samtilbo? This is what you're talking about. Oophorectomy.
Yeah, nothing will happen to the ovary that was left inside your body. So as you age, that will proceed with the natural aging process. Okay, eventually that will shrink down, atrophy. Okay, in medical terms, and then that's just it. Then you'll undergo menopause already. Okay.
So she's 48 years old now,
48 years old
so
now.
she's pretty close to.
Pretty close, yeah, to that period. But
So leaving it in there doesn't
just-
increase cancer risk. No other health hazards as well.
At this point in time,
Okay.
if it did not develop cancer, then it won't it won't be okay.
Okay.
Just make sure that you are still monitoring yourself, going for your routine checkups. Okay, then that's about it.
That's good news. Next.
Thank you. I actually learned the term tauso because of Miss
Yes.
Mervs. Thank you.
Also.
Okay. Another question coming from Ms. Gina Espinosa. Had Cabiso biopsy shows endometrial cancer stage 3. Doctor recommended chemo and radiation, which honestly I'm not so afraid of. Thanks for enlightenment and hope you okay. Thanks for the enlightenment.
Okay.
And if you being afraid of the chemo and the radiation therapy side effects is really quite valid.
It's valid. And I would say if you didn't come for today's program and you're just going to do chemo alone, yes, it's something to be kind of concerned about. But we have protocols to minimize the side effects.
Yes,
That's
so-
why you can be
So
comfortable.
if you are someone who's working and you would wish to continue working while undergoing the chemo and the radiation, then please go for a consult so we can give you the appropriate protocol so that to minimize the side effect of chemo and radiation. Okay? For endometrial cyst, endometrial cyst, the prognosis is really quite good. Okay.
What about Gina? There's a question from Gina Espinosa.
Oh, that's the one that I actually read.
Oh, okay. That's
the
good.
Cabiso. Alright. Another one coming from Ms. Lloyd's Center. Can HPV be resolved after years?
Can HPV be resolved after
years. That means on
its own?
On its own,
Most
is it?
Most often than not, HPV resolves on its own. So
Oh.
your immune system fights it off.
Okay.
It's just that some people actually cannot fight off the effect of HPV. So for these people, they either develop genital warts or they the damaged area develop into cancer. So if it's the cervix, then it can develop into cervical cancer. If it's the mouth, because of you know what I mean, so people can develop oral cancer. Okay, a cancer inside the mouth. Okay, yeah.
All right.
Okay. All right. Okay. All right. Another question, because we were talking about diets a while ago. One person asked about, can cancer patients take psyllium husk for fiber?
Oh yes,
Of course.
of course.
This is very helpful, especially if you are someone who loves your steak and you hate your vegetables, and there is somehow no way for you to eat vegetables at all. Okay.
Yeah.
So, chef, of course, habits need time to form. Behavior change takes time. Okay. So it's not an immediate. It's not immediate that you can shift from a primarily meat-based diet or an animal-based diet and immediately shift into to the other side to become a plant-based diet. Okay, so of course, considering your case that you have cancer, then it's very important because
To immediately have fiber.
yes, immediately have fiber. Time
And
is
psyllium
against
husk
you.
is a good
So
source.
psyllium husk as a temporary solution can replace it. However, don't rely on it for a very long period of time because psyllium husk is just psyllium husk.
You need like
You need-
all sorts of nutrients
Yes, you need
and
the-
different types of fiber.
Yes, you need the nutrients from the fiber.
Yeah.
You need the nutrients from the real
Vegetables
food, the
itself.
vegetables, the fruits, the whole grains and legumes. Because by eating these 4 food groups, then you can in fact have the benefits of the anti-cancer. Their anti-cancer properties or their anti-cancer benefits. If it's just psyllium husk, then psyllium husk will just make you poop better, so you eliminate the bad stuff from your stomach much faster. Number 1. Number 2, it's just so that your gut microbiome the good bacteria inside your gut microbiome can eat the proper nutrient already, so they can produce
Anti-cancer
anti-cancer
butyrates.
properties like butyrate, short chain fatty acids, these stuff. Okay.
And for the person that for the one that's gonna take psyllium husk, remember to drink a lot of water, or else the effect of psyllium husk will be the reverse. You will get constipated instead. And if you're taking your favorite brand of psyllium husk and it's not working for you, try our cleanse. All right, Simply Nature actually does have a dietary fiber. Doc, you prescribe cleanse a lot, right?
Yes,
all right.
and I personally I have tried a lot of different fiber supplements. So far, cleanse really
Tastes
packs
good.
a punch. It
Actually tastes good.
It tastes good.
Yeah.
I love to experiment the things that I give to my patients and myself. So
Yeah.
that's fine.
You know,
Yeah.
Doc, we actually have patients who put the cleanse into cake.
Oh really?
They mix it into the cake batter and then they bake it. So it ends up being a very high fiber cake.
They do that.
Yeah,
I
because
do
it has
also
fruity
that.
flavor, right?
Oh,
yeah,
yes, yes.
And so your cake become a high fiber cake. All right, because
Wow,
I
that's
don't.
quite interesting.
Because I don't know. I don't think the fiber breaks down under heat so much. It doesn't, right? So
It doesn't.
you really end up with a high fiber cake.
Yes, the fiber, whatever fiber is in the cleanse
Yeah.
sachet will be inside the cake.
Okay, so do try. You can try our cleanse. It's just very effective. If you already have psyllium husk, continue to use it. But if you would like to try something new, I give the cleanse a recommend. All right.
Okay, thank you, Doc. Thank you, Sir Sean. All right, another question. How long should we take PPARs? Because currently I'm on calcium and vitamin D given by my oncologist after completion of my chemo. I stopped taking heart med as it makes my blood pressure drop.
What did she say? When she should stop taking PPARs?
How long should she take PPARs?
Oh.
Because she's
Okay, number one,
currently on
it doesn't sound like she's taking PPARs now. So my first thing is take PPARs now. Okay, it's really one of the best supplements you can be on for after your cancer treatment. All right. So as for how long you can take it for, let me give you the good news. The good news is there's no reason to stop taking PPARs because I am not a cancer patient. I'm taking PPARs, and I've taken PPARs ever since I was 27 years old, and I am 48 years old this year. So I've taken it for 21 years. 20, no, sorry, I took PPARs since 2002. So I've been taking it for
20 years.
20 years, right? So so that means why do I take PPARs when I'm not a cancer patient? Because I take PPARs to maintain so that my metabolic syndrome, so that I won't have any metabolic syndromes, keeps my inflammation down. And the real reason that motivates me a lot to take PPARs is that PPARs, we don't talk about it much on this program because we are talking about cancer, but PPARs does have an anti-aging effect. All right, and many of my patients, Doc, I haven't shown you this testimony. That there's this cancer patient who has a lymphatic, I think, so that the lymph node swell to this size, okay, really like this size, and then when she took liquid, it shrank.
Wow.
But you know what she's so happy about? She said, my colleagues say my skin is glowing. So
we are made.
So the cancer tumor going down, she's happy. But the thing she's most happy about is that her skin is glowing, her pores closed. All right. So one of the effects of taking PPARs is that it's really anti-aging, gives you a lot of energy as well. So to the patient to the viewer who just said that she's only taking vitamin D, prescribed by her onco, go on the PPARs. There's actually no reason to stop it. It's not expensive at all for the PPARs tablets. Our extracts are definitely a bit more expensive because it's really used for treatment to mitigate things like chemotherapy. But the tablets are to support you. So compared to just vitamin D tablets, no, definitely. Take PPARs and it'll keep your blood cholesterol, blood sugar, everything healthy, and makes you look young, right? So that's the thing. Okay, but if you're just saying for cancer maintenance, I think make sure you cross the 5-year mark, right? Make sure you cross the 5-year mark.
That's what I would advise.
Yeah, so you take it for 5 years. Whatever supplements you're taking now, even the vitamin D and things like that, and your healthy lifestyle, don't stop after half a year or 1 year. Continue for at least 5 years. Cross the 5-year mark.
Yes, the goal is to put you, of course, on the maintenance, which are the tablets. In fact, sir, I'm very pleased to know that we have a lot of clients way back, years ago, who are taking liquid and powder before because they have cancer, but now who are just taking tablets, and their family is also taking tablets with them now.
Yeah,
So,
see, imagine the whole family is taking now. Okay, I see a question by Joy. Yes, Joy, that's the great thing about what PPARs can do. Yes, it can really reduce the side effects of chemotherapy and radiation therapy. And everything that you wrote in your comment, right, is the reason why you have to take PPARs. In fact, one of my personal friends and a patient that I referred to, Dr. Jansen, she's patient A. She's working really, really hard, and she had brain tumor, her breast cancer metastasized to the brain, but now she's working every day really, really hard because she's a breadwinner for her family. So she was able to do that with the PPARs, all right? So I hope that answers that question. I saw Legaya Tan asking.
Legaya Tan.
Yes. The answer is yes, and you are a lupus patient. So this is something we talked about during our doctor's conference last night. Usually, any supplement that boosts the immune system, you will be worried to give it to a lupus patient because as a lupus patient, your immune system is attacking your own body. So the good news is that we have, I have a personal patient, client who is a lupus patient. She is a chronic lupus patient, so she had lupus ever since she was a teenager. It really helped her. And how long? I noticed she was on the soft gel. She reorders without coming to talk to me again. She was on it for I think 2 years. Right? So perhaps after 2 years, basically now, even if she doesn't take it, she's probably okay already, and the thing's being rectified. So to to Miss, I think it's Miss Lagayatan. So I hope that's the good news for you. It's a yes to all your questions. And for lupus patient, our immune, even though we modulate the immune system, it actually works well for lupus, being able to correct the immunodeficiency. And not only this, we have lots of such feedback and patients in other countries outside of Philippines who are lupus patients. Because here in Philippines, we are predominantly, our patients are cancer patients. But in other countries, the feedback from our other distributors is really great for lupus patients as well. So I hope this is good news for you.
Exactly. Thank you, sir. Thank you, Dr. Jansen. All right, another question coming from Ms. Mui Kengo. I had breast cancer in 1999 and thyroid disorder in 2001, cardiomyopathy in 2016 with 3 high. What is your advice and what products of PPARs is best for me?
What about the cardiomyopathy 3 high?
Yes, with 3 high, she said.
Let me read the comment itself.
All right, Mui Kengo. I had breast cancer in 1999, a thyroid disorder in 2001, cardiomyopathy in 2016, and 3 high. What is your advice and what products are best for me?
What do you mean by 3 high?
3 high, is it high blood cholesterol, high blood sugar, and high blood pressure? Is that the 3 high?
Yeah.
Because that in
You might want to follow up.
yeah, because that in Chinese is the translation. Because in Mandarin we say san cao. San cao refers to high blood pressure, high blood cholesterol, and high blood sugar at the same time.
Okay, at the same time. If it is so, then we have to correct the metabolic disorders that you have. So high blood pressure, high blood cholesterol, and diabetes. Okay, we have to correct that and focus on that. If you have cardiomyopathy, another question would be, can you tolerate exercise? Because if you can, then it would be important for you to begin physical activity in order for the cardiomyopathy to prevent it from progressing faster. Okay. Also, you already had breast cancer since 1999, so that would already, since it's 1999, I'm assuming
22 years, 23 years.
I'm assuming
you're
that
free.
Currently you are doing well. It has not recurred at all. Should you be worried about that? No, I don't think you should be. Okay.
Especially if you get rid of your 3 high.
Yeah, because it's been 20 years and you're still okay. Okay. So chances are it won't recur already. The thyroid disorder, one question would be, are you taking any medication for the thyroid disorder? Is it still active? That would be one of the questions as well. Because the 3 high blood cholesterol, high blood sugar,
high blood
pressure can be rooted with the thyroid disorder. So if we treat the thyroid, if it's really the thyroid that is abnormal, then we have to treat the thyroid so that you can control for those 3.
Oh, she says yes and yes. Okay, just to interject here, Doc. Mui Keng, the good news is our PPARs treats the 3 high at the same time with only one product. So you don't have to take 3 drugs to treat the 3 high.
Yes.
Okay, it works across the board because it modulates the entire metabolic pathways.
But if you really want to, reduce it or in fact reverse it, I suggest you go for a consult so you can take a look at everything.
The details.
The details, the drugs that you're taking, the laboratory results that you have lately, and how we can help you. Because this one, it's actually your case is actually quite straightforward. So we just on the get-go, if certain things are really quite high, dangerously high, so of course we have to prescribe you medications, but it would only be temporary, just to control for the parameters. I'll prescribe you a lifestyle prescription. Then once you're on the lifestyle prescription, we wait for the parameters to go sufficiently down, then we start removing one by one. Okay?
Yeah.
But of course, in order to hasten the process, you have to be on PPAR agonists. I'll prescribe you the appropriate protocol as well. Okay, so that would be the whole picture, bird's eye view of the whole journey.
treatment journey.
For everyone that is viewing us right now, viewers of this program have a special privilege. It's a cooperation by Simply Nature and Doc Jansen's clinic, Simply Healed. So what we are going to do is just ask Beth or Sheila, whoever is helping you book the consultation with Doc Jansen, and it will be a teleconsult, so don't worry, you don't have to come right down to his clinic. Just ask what is the arrangement, so we will have a nice surprise, a nice benefit for those who arrange the consult through this program.
Yeah.
All right.
Okay.
Alright, for those who wish to have a consult, just type in how to consult so that Ma'am Beth and I can actually go with you or get in touch with you individually. Alright? Okay, I think this will be our last question for tonight, and I think she just came in. Yeah, because the question is, my sister got diagnosed with uterus cancer. Her operation is happening this 22nd, and it's for total hysterectomy. Does she need to go for chemo after that?
Depends on the stage. Depends on the stage and the biopsy of the result. Okay, because there are different types of uterine cancer as well. So really depends. If the onco suggests that she go for the chemotherapy, then she should.
And she won't need to be afraid, because if she's undergoing chemotherapy, just have a consult with Doc Jansen. But even if she's not going to go for chemo, go and have a consult with Dr. Jansen, because it's so important that when a patient fights cancer, they have proper and good advice. And one of the advice that you always hear from oncos that, how should we say it? You don't need to say it, I'll say it. We don't agree with. If ever an onco tells you, you can eat anything while you're fighting cancer. That is absolutely not true. Why? You got cancer because you ate the wrong thing over many years. So while you're fighting cancer, if you're going to eat the same things that gave you cancer, you're not helping your fight against cancer, right? It's like you got sore throat because you ate a lot of chocolates. And then you go to the doctor, and if you go to a conventional doctor, they'll give you a cough syrup. And then I used to love to see the Western doctor so much, because in front of my mother, I will ask the Western doctor, "Doc, if I drink the cough syrup, can I eat anything?" The doctor will tell me, "Sure. As long as you eat your medicine, you can eat whatever you like." And my mother will be so angry because and it's not true, right? You got a cough because you ate too much sore throat because you ate too much chocolate. If you take the medicine and you eat a lot of chocolate, you're gonna get your sore throat and it's gonna get worse. So that's not true. So I think it's very important for cancer patients to understand that there are many other aspects that they need to take care of. Not only their cancer, they have to take care of their liver, their kidney, their lungs, because these specific organs will come under a lot of stress during cancer, and if they get damaged, or if they are weak, or they are not functioning properly, it will have an impact on the results of your cancer and definitely in your recovery. So these are things that you want to take care of as you fight cancer. So that's not the specialization of your oncologist, and rather than go to a nutritionist, who again is not a medical doctor, why not go and consult a doctor that specializes in this area like Dr. Jansen, so that you get clear advice on what to do while you're going through cancer treatment.
Thank you, Sir Sean. Very, very quickly, let's just give a chance to this person who asked, because I think the concern is that he doesn't have any health issues, but what is the supplement that she can take from us?
Okay, if you don't have any health issues, then you fall into my category and also Doc Jansen's category. All right, so here's the interesting question I asked. Doc, do you take PEPA tablets?
Yes, every day.
Every day. I do too, and I've been taking it since I was 27 years old. I'm 48 this year, so I've been taking it for 21 years. It's one of the best basic supplements you can take. You don't have to take the extract, just take the basic tablets. If you ask me, the best supplement that we Simply Nature sells is actually the tablet. because the tablet does so many things. But of course, for cancer patients, you take the liquid extract because you need specific boosting regulation of certain pathways. But the tablets are the best things that we produce because it does so many things. Super nutrition, gives you vitamins, minerals, trace phytonutrients, and it contains PPAR agonists. So it's the best basic foundation. So on top of that, you can take whatever additional vitamins and minerals that you think you need. But once you start with the PPAR tablets, you're pretty much good for everything.
Yes. Right. Just before you give your very short parting words, I just want to, of course, greet our avid viewers. We're still always with us, of course, coming from Miss Lily of Malaysia, Lilibet of Philippines, Miss Edna Agveo. Thank you for watching us again. And yeah.
I'm curious, Mui King, where are you from? I don't know why I feel like you are Malaysian or Singaporean. Okay, just
Type that in. You don't have to go to the Philippines to have a consult. We do online consultations.
Yeah.
Okay. All right. Okay. So of course, as you know, please give our viewers and our new registrants, our new joiners of our Simply Healed webinar the parting words for tonight. Starting off with Sir Sean.
Sheila, what's our next topic for next week?
Oh, okay. I was about to tell you that because by next week, same time, Thursday, we will be having the 10 hallmarks of cancer.
Oh, okay. So my last words is next week's program, ask all your friends and family, anyone who's interested in cancer to watch, because that's actually a very good topic to next week.
Okay.
Next week we are actually gonna Doc Jansen gives us some idea that actually chemotherapy is almost works in a holistic way, in the sense that they use different type of chemotherapy drugs attacking cancer, and there are basically 10 gates, all right, 10 directions you can fight cancer using chemotherapy drugs. That's why nobody takes one chemotherapy drug. It's usually a mixture. It's like a Maron, you go to a bar and you drink a cocktail. They mix gin with whiskey. Yeah, so it's a very interesting topic, because do you realize when you go for natural supplementation, you are also attacking cancer from different angles. And chemotherapy also uses that same approach. But many people don't realize that. So to next week's topic, very interesting. So tune in, you will enjoy it, and you will learn a lot. Yeah, I stole your line.
Okay. Next week's topic is really quite interesting, because we actually, in this current era of cancer treatment, we actually approach cancer in 10 different ways. Okay, so that's why the 10 hallmarks of cancer. So each hallmark of cancer, we actually have a specific chemotherapy drug for it. Okay, and can we have a similar effect for natural treatments? Okay, so please watch the webinar next week, next Thursday. I won't spoil you any further, because you have to find out for yourself. Okay, so last words for tonight. Our topic tonight is ovarian cancer, and you have learned that ovarian cancer is actually a type of cancer which recurs quite frequently, and most often than not, the symptoms are quite non-specific. It's actually quite benign, okay, the symptoms. And once you feel symptoms, then you go for a consult, and more often than not, if it is ovarian cancer, it is already too late. Okay, I have had relatives who died from ovarian cancer, so actually ovarian cancer is quite close to my heart. Okay, and sadly, this relative of ours decided to not to pursue any treatment at all already, because by the time that she was diagnosed with ovarian cancer, it was already in the late stage 4 ovarian cancer. So please, for those of you who have had the privilege, or who have been very lucky to find out that they have ovarian cancer early on in the stage, no? Stage 1, stage 2, and even perhaps stage 3, okay? Please go for the chemotherapy, the necessary treatments, okay? Because it's just sayang, okay, if you don't go for for further treatment, and you just rely on surgery, hoping that you are already cancer free and just rely on natural treatments. Okay, I'm all for natural treatments, but don't just rely on one treatment modality. Consider other treatment modalities because they really work well together. I'm confirming and telling you now that it works well together, and the way that they interact is
Next
just
week, we
synergistic.
will talk about it.
Yes,
next week
we'll
talk
be talking
about
about
why
it.
natural and
Yeah.
and conventional. And I sorry, second last word is this. Okay. Natural works. You know why in our program we have many questions about chemotherapy, and then we seem to be talking a lot when we should be talking about natural thing. Here is the thing. Here's the thing. When we talk about conventional therapy like surgery, chemotherapy, radiation therapy, it is consistently executed. But when we talk about natural, we are talking about living correctly. We can't control the patient when you all go home. You know you're not supposed to eat this, you eat this. You know you're supposed to eat that, you don't eat it, right? So, in a way, the natural therapy is hard to execute because it's not within our control. But surgery is within the control of the doctor. When you go for chemotherapy, you can't run away. When you are there, you are given your chemotherapy. At home, when your wife gives you the vegetables, you quickly throw it in the dustbin and pretend that you ate it. You can't do that, That is the reason why we sometimes talk about conventional. But actually, on our side, do you realize that Dr. Jansen's consults will always be on the natural side, So he's just telling you, you do the conventional, he'll help you with the natural so that you get the best of both worlds.
Thank you, Sir Sean. Thank you, Doc Jansen. Once again, our topic for next week is about 10 hallmarks of cancer, and we encourage you to please tag along your friends or
invite friends.
Invite your friends or your fellow patients with you so they can also watch and ask questions for themselves as well, because after the discussion we'll also be having the AMA or Ask Me Anything portion. All right, okay, another question that was asked was, is it available in drugstores? No. Right, our products are actually available, all right, from our office, directly from our office, Shopee, and of course Last Mall. We are not only in Lazada, we are in Last Mall because we are with authentic and legit.
Okay, the other options is our products are only available through doctors. So there are many doctors in Metro Manila and all over Philippines that carry our products. But again, there are many doctors, so your doctor may not carry our products. All right, so either get it through Dr. Jansen, so his clinic carries our product, or you can get it through what Sheila shared, right? Just type in how to get PPARs. I'm sure Sheila will get to you, or Dr. Jansen's healthcare specialist, Beth, will get in touch with you.
Yes. And once again, for those who want to have a consult with Dr. Jansen, just type in, please how to consult. Okay. All right. Okay. Just before, very quickly, our promos for AD Pro, which is buy one take one, is still on up until October 31. And also if you buy powder extract and liquid extract, it is also available. It comes with the freebie of worth 2,700, which is the AD Pro serum. Okay, very excited to share that.
No, because every time AD Pro comes up and we are talking about cancer, let me share with you who can really use the AD Pro. Cancer patients who are going for radiation therapy. Use the AD Pro to treat your radiation burns, all right? You just apply it onto your radiation burns. It will do a lot of good, help your burns heal faster, okay? Yeah.
Yes, also for chemotherapy patients who are experiencing some side effects in terms of itchiness, it's also perfect for you. Okay? All right. Well, once again, we would like to say thank you to all of you who watched our Simply Healed webinar Ovarian Cancer topic tonight. And we hope to see you once again in our next webinar next week. here in Simply Nature. Because here in Simply Nature, we are always with you from start to healing. Thank you, everyone. Good night, and God bless you all.